The CDC says it's still too soon to remove face masks indoors, even as Massachusetts and other states drop more COVID-19 restrictions. Here to share his expert advice is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Hello, doctor. Good to see you.
Hey, Dr. T. Great to see you. So we now have a date. 2 weeks from Monday, February 28th, when the state will no longer require masks inside public schools. Instead, local districts will decide what they want to do. So what kind of data should they consider when they make that decision?
Right, to mask or not to mask. There's such debate around this and controversy. One of the reasons is because masks have worked so well to protect our kids. So I absolutely agree that right now cases are too high. We're still above where we were with the Delta variant as far as number of cases. So right now, not the time to remove masks. But I think Governor Baker and his team are seeing a serious decline in number of cases, hospitalizations, and probably predicting that over the next 2 or 3 weeks, they'll be at a low enough level where that will be reasonable. But remember, doing away with mask mandates is not the same as saying our kids should not wear masks in schools. That should be an individual decision and a decision left to the districts and school systems. So I think we're heading in the right direction.
When you say individual, Dr. T, you mean like the individual family, even down to that level?
Absolutely. If you have a vulnerable child, if you think there's more cases that are necessary, if you have an anxious child that's doing better wearing a mask, by all means, I hope that child continues to wear masks even long after these mask mandates are a thing of the past.
So as you know, face mask mandates are controversial, not just for parents and schools, but now it appears for doctors as well. As we just said 2 minutes ago, the CDC and the American Academy of Pediatrics continue to say keep those masks on. Other health experts are telling governors it's safe to take them off. So whose advice should people take?
Maria, let me tell you what I will do as a parent, not just as an infectious disease expert. I really listen very carefully to the CDC and especially the American Academy of Pediatrics. They really know best. So the mask mandates may be gone on February 28th, but if American Academy of Pediatrics are still recommending that, I know that Mal and myself will really, we'll talk together and most likely we'll want our kids to keep their masks on.
Dr. T,
for some period of time.
There is a new report, as you know, from London that Prince Charles has tested positive for COVID-19 for the second time. First time was back in May of 2020, and now here we are in 2022. Is it unusual to get infected again, especially for someone who has been vaccinated and boosted?
And it's not unusual at all. There was a study from the UK that showed the Omicron variant reinfection was 5 times higher than it was with Delta. Remember, Omicron can evade our immune system. It has a way of evading the vaccines. Remember, vaccines are still, and boosters are still so important against preventing severe infection. They also reduce infection, but these variants they're getting better at evading our immune system. So it's not surprising. The good news is he's doing well. We're hearing that the Queen doesn't have any symptoms at this point, so it's good news. Remember, the vaccines, what they do best is reduce severe infection. That really is the key.
Dr. Todd Ellerin, thank you so much. Be well, doctor.
Take care, guys.